Hello, this is Celeste Montfortin. I'm here in San Marcos, Texas. I am a lecturer in public health at Texas State University, and I am also privileged to be the liaison for ADAO between the Prevention Board and the Science Board. It is my privilege today to introduce today's keynote speaker, Rebecca Reindel. I first met Rebecca when she was a student at George Washington University, and she was working towards a master's degree in public health. And it would be her second master's degree because she already had earned a master's of science degree in toxicology. So I knew that this was really an impressive person. I came to know Rebecca's passion for worker health and safety when, for her master's thesis, she teamed up with taxi cab drivers in New York City. And together they examined the drivers' experiences with violence on the job. With 2 graduate degrees in hand, Rebecca worked for the Federal Occupational Safety and Health Administration in Washington, D.C. in its Directorate of Standards and Regulations. In 2014, Rebecca was hired as the Senior Safety and Health Specialist for the AFL-CIO and its 12.5 million members. In 2019, Rebecca became the organization's Director of the Safety and Health Department, which includes coordinating the AFL-CIO's 55 local and national safety and health committees. I, on behalf of the American Public Health Association, had the privilege of testifying side by side with Rebecca in 2019 at a legislative hearing in the House of Representatives in support of the Alan Reinstein Ban Asbestos Now Act. The AFL-CIO is a critical voice in this asbestos fight, and we hope a victory banning asbestos in the US is not far off. I could certainly go on and on about Rebecca's accomplishments and leadership. I am very proud to know her. I'll put my hands together and turn the microphone over to Rebecca Reindel.
Thank you very much, Celeste. Really appreciate that introduction. Hi, everyone. It's a real pleasure to be here. As Linda does, she really finds a way to bring us all together. Thank you so much, Linda, for this invitation. I believe I first met Linda at this conference, actually. Since then, we've worked very closely together on the RBAN legislation to address asbestos exposures. And we testified next to each other to support that legislation, as Celeste mentioned. I work for the, I'm going to start my slides here. Let's not get ahead of ourselves. So I work for the largest federation of labor unions in the United States, as Celeste mentioned. We actually now not represent 55 unions, we now represent 57 national union affiliates across a wide array of industries. And our affiliated unions cover the industries and the occupations that you might imagine: manufacturing, construction, healthcare, bus drivers, teachers, firefighters, flight attendants, mechanics, and I could go on and on. It's very diverse. And also there's others you might not imagine, like Hollywood actors and stagehands and professional sports players even. Speaking of, I want to share some timely news. On Thursday, we just welcomed our 57th affiliate to our federation. The National Women's Soccer League Players Association is now an affiliate of the AFL-CIO, and we represent them. This is very exciting for us. So I'm just gonna do a little collective clap. So asbestos is a major part of the Federation's safety and health work. My job at the AFL-CIO is the Director of Occupational Safety and Health. Our team plays an important role in the national and international policy space in advocating for stronger safety and health protections on the job, using evidence from workplaces, using public records, studies, and cases. And I was raised in a union family and know the importance of that representation, especially on workplace safety issues. But a lot of workers in the US don't have that representation, and we advocate for all working people. The thesis of our work and the regulatory systems that we work within to gain protections for people is that it shouldn't be a luxury to come home from work in the same condition you went to work. We work on prevention. We push policymakers. We work on making jobs safe because it is a basic human right. I just want to check one thing on my slides. Sorry about that. I don't think that they were working. So for decades, labor unions have been fighting for, and we have won strong protections against many toxins in the workplace. Most recently, silica dust and beryllium dust, and many other chemicals throughout the past 50 years. No doubt, these protections have saved lives and have noticeably improved people's lives. The OSHA silica rule in 2016 is why you now see construction workers using saws with attached hoses or vacuums instead of working in massive dust clouds when they are cutting rock, brick, and concrete. We are preventing silicosis, another fatal lung disease, because of these simple measures, but it has been a century-long fight. Aside from the ongoing COVID-19 pandemic, which is raging through workplaces right now, making many people severely ill, asbestos is the most significant occupational disaster of our lifetimes. The largest extent of asbestos-related disease burden in the US is a result of work exposures. You've heard this through many personal experiences shared throughout this conference, and it's what other evidence shows us too. Workers are exposed to asbestos at all stages of the chemical's life cycle, when manufacturing it, transporting it, installing it, doing maintenance, doing removal and disposal, storing the chemical, and workers are a conduit for bringing asbestos home to their families through clothing, equipment, skin, hair. Workers often receive the highest doses of a chemical exposure of anyone because they are working around it for entire work shifts every single day. And unlike at home, it is the employer who controls the work environment and the safety conditions. So change has to happen with them. This is why we have basic workplace safety laws in this country. It's also why our role is to focus on improving them and making them stronger. Just since 1999, more than 50,000 people died from mesothelioma and 25,000 from asbestosis. Another 300,000 to 500,000 people are expected to have died from other asbestos-related lung cancers and other cancers related to asbestos. As you all know, these statistics are people. Just this week, I heard from a retired transportation worker who did bus maintenance for his career and became the safety director for 15 years for his local union. He was just diagnosed with pulmonary fibrosis caused by asbestos-laden brakes and its dust. But as you've heard through this conference, even if you're not directly working with asbestos-containing products, in the US, asbestos is widespread. Throughout refineries, powerhouses, steel factories, schools, utility infrastructure, homes, office buildings, hospitals, and other places where people go to work every single day. Combating myths about asbestos can be tough. If asbestos is in place, it's fine, right? Many people don't realize why the existence of asbestos in buildings now is actually a worse situation than it was decades ago. The fibers have deteriorated over time, and with changes in environmental conditions like moisture, humidity, vibration, more of the asbestos is friable. So exposures have become more significant. Worse, many workers, like school janitors, for instance, don't even know they are disturbing asbestos when they are assigned maintenance jobs in the building. We are also now using newer technologies that blast and break material with greater force, creating more significant dust exposures. The International Labor Organization has found there to be no safe level of asbestos. We cannot engineer our way out of this one. Another myth, people dying now were exposed decades ago. It's not a current problem. Do you know who is working with new technologies? Younger workers. Do you know who is doing a lot of hard labor with building materials? Younger workers. Also, because of what I just mentioned, new people on the job are facing higher exposures from this. The CDC and other data show that a new generation of workers have significant levels of asbestos disease and death, notably workers aged 55 and younger. These are workers who would have entered the job market in the 1980s and later, after we supposedly took care of the asbestos problem. An insulator in Chicago who started the trades in 1993 was screened in 2016. And not long after, he died at the age of 45 with elevated levels of asbestos fibers in his lungs. Clinic data also show workers in their 40s appearing with asbestos-related disease. This makes the need to assess the full scope of asbestos in our infrastructure and the need to safely remove asbestos more urgent than ever. And this is just a slide showing what happens after natural disasters and other incidents of cleaning up asbestos that's out there. So I want to get into Scotty's story. I want to talk a few minutes to share an experience of my friend and colleague Scotty with his permission. In 1988, Scotty was a utility worker and as an apprentice in New York City. Scotty worked a demolition job at a power plant, removing old coal hoppers. The workers used a pneumatic chipping gun to remove the refractory cement, which blew air, dust, and everything else in an enclosed space around the workers. Now, Scotty did this job for about 2 to 3 months. His employer gave him and his coworkers simple household paper dust masks to do this job, which clogged up quickly each day before lunchtime. The job was so dirty and the masks so weak that workers needed to change masks often. The employer would run out of new clean masks to hand out, so the workers were left to wrap rags around their faces. After each shift, he and his coworkers would blow black stuff out of their noses. Now, asbestos wasn't talked about in the utility industry at the time, so the workers didn't know that the dust they were breathing in and getting all over themselves was more than just dust. These industries at the time did not do sampling for asbestos or medical testing for their workers, even though they were exposed to asbestos. These industries didn't do education and training for the workforce about what they were working with, even though workers had the right to know under the law. These workers weren't provided or told about Tyvek suits, respirators, and other forms of proper personal protective equipment, or PPE, as everybody now knows the term in the pandemic. In fact, the company denied Scotty and his coworkers were even being exposed to asbestos so that they wouldn't have to comply with some of the regulations that did exist at the time. So the workers went about their jobs without protections, without notification, and the company was found later guilty of lying. The next year in 1989, there was a steam explosion at that site that killed several workers. The explosion also released more than 200 pounds of asbestos into the air. This massive explosion raised awareness of asbestos and existing infrastructure. It brought lawsuits and brought attention back to the need for strong workplace protections through regulation. This led to more oversight on companies to start creating systems of protections in their workplaces. So what did these workplace protection systems do? They required employers to train and license people working near, around with asbestos. They called them the asbestos handlers. They required employers to follow certain protocols, procedures, and provide adequate PPE and actual respirators for working around this stuff. The protection systems required employers to set up medical monitoring programs so that people would be screened for signs of disease and identified early if they've been exposed, and to get them on the appropriate medical treatment plan for early interventions. Actually, without the medical monitoring programs, Scotty would have never known he had a medical condition from his asbestos exposure in 1988, from that 2 to 3 month demolition job. In 1994, as part of being in one of these programs, Scotty was diagnosed with pleural thickening, a sign of significant asbestos exposure. He actually thought it was a mistake. This stuff takes 20 years to develop, right? But it can be much faster with significant exposures. But even with these good programs set up, getting the protections wasn't automatic and it wasn't easy. It was because of Scotty's shop steward and his union, who was proactive and ushered Scotty through the process, that Scotty found out that there were regulations his company should have followed during his job, which eventually led to some financial compensation for his disease. But we know that's not enough. It was also because of unions and workers organizing together that they could use the regulations to get proper respirators for those working with asbestos, and that they could get adequate training so workers know what they are working with, the safety practices and equipment that they can expect from their employer, and the safe practices they would know to follow themselves. And they also fought together and won washers and dryers in their locker rooms too, so they didn't have to take it home. I'm happy to report that Scotty is doing well here in 2021. In fact, I work with him on the national level, and he's our national safety director and activist for the Utility Workers Union, his home union, and there's no better fit for that work. But Scotty's story, unfortunately, is not all that unique. Let's look at what happened. Workers were told to do a job without all the pertinent information that affected their lives, their safety and health. The company denied everything, denied that there was a problem, forced workers to work in dangerous conditions, told workers to wear flimsy masks and rags to make them feel like they were provided protection when they were not. The company did not provide multiple layers of protection, including other safe practices besides PPE. The company eventually would put what unions called magic tape around an area. It said to workers, stay out, but no actual barrier to keep them from breathing in the toxic dust from something that travels very easily through the air and room to room. Workers were forced to bring diseases back home to their families. And in the aftermath in Scotty's case, the company wouldn't tell the union stewards the number of people who were affected. The union had to fight for that information. The industries blocked life-saving regulations that would ensure exposures were prevented. But it was the important laws and regulations that changed the industry practices and the technologies and saved lives. Now, doesn't that playbook sound eerily familiar? We are dealing with the same issues in workplaces during the COVID pandemic, and we've seen this pattern time and time again with asbestos and other chemicals. It's getting worse again with asbestos because people think the issue has been taken care of. Also, in Scotty's case, and in so many cases, it was the union who fought for stronger regulations and laws, but also helped the workers navigate the process if they were exposed or became sick. It's because of unions that we have the safety laws that we have. They do advocate for and win through contracts and also through laws, education and training, and other, and specific PPE, other protections from retaliation for workers raising safety concerns so that they can do that freely when the workplace is dangerous, and helping workers navigate a messy process of compensation and other avenues when it's time to file a complaint. The workers of the Insulators Union, those who installed asbestos and became very sick initially when asbestos was installed within the infrastructure, were actually called the asbestos workers. You talk to people who worked in these industries in the 80s, and they say you ran into more people who had asbestos-related disease than those who didn't. Yet, as my friend Terry with the Insulators Union, who saw asbestos disease countless times within his union, he said they called it the orphan disease. It didn't get the attention of other cancers. It was easily ignored. The people who became sick and their family members lined up in Terry's office. The Chicago Insulators Union then worked hard to set up an early detection lung screening, cancer screening program, and no one else was monitoring these diseases, but their union started to. Employers actually started labeling pipes and other structural systems in workplaces as not asbestos, because that was easier than labeling all the areas that had asbestos. And a lot of that is still in place and it's falling apart. The power plants today, like where Scotty worked, were built in the 60s in a cookie cutter model where asbestos lined the coal tar lines, the water mains, and the substations. Electrical workers, laborers ripping out ceiling tiles and flooring, carrying these materials, pipe fitters, utility workers like Scotty, maintenance, and many other workers worked with these to this day. It's in the gaskets lining the piping systems, it's at the boilers and the floors. And homes become workplaces too. Contractors work on houses, and in the aftermath of disasters like hurricanes, many workers clean up, move materials, transport, and renovate homes and other infrastructure, buildings, utilities, etc. The workers often doing the massive cleanup work are especially vulnerable. They're not unionized or properly trained, and they do not always speak English and do not know their rights and have major fears of retaliation for speaking up against unsafe working conditions. Workers are walking in blind for a paycheck, unaware of the hazards they face, with no protection systems in place or oversight for their employers. Last week was the 20th anniversary of 9/11. While asbestos exposures were a major issue in the crisis and aftermath, I wanted to bring up that day for a different reason. People who worked and volunteered to respond and clean up were told that the air was safe to breathe. But in the following years, so many workers and community members faced serious health conditions because of it. The government eventually established a health program and health fund for survivors in 2010. The government didn't just step in automatically, though. It took massive numbers of activists, including unions, community groups, medical experts, and even celebrities to push our federal government to act. And it took skilled people to run these programs on the ground and deliver excellent medical care, and relentless work by activists to continue to push the government to ensure strong protections stayed in place. In 2015, we won permanent coverage for the health program that was initially only created for 5 years. And in 2019, they made the fund permanent. And just last month, several Congress members introduced a new bill to address funding shortfalls with these programs. So that's the next step. When this most recent bill was introduced, the 9/11 bill, Congressman Nadler said, "I have been working for 20 years to help expose the lie that the toxic dust that covered Manhattan in the days and weeks after 9/11 was safe to breathe, and to make sure anyone who became ill or is still living with the impact of that lie receives the help they need and deserve." This issue isn't going away. It is only getting worse as more people get sick and new diseases emerge. We have a moral obligation to act now and stand by responders and survivors as they stood by us 20 years ago. That was his quote. You could say the same for asbestos, but with asbestos, we still have the chance to prevent. So look, the government can do the right thing, and the government has done the right thing in other cases. And the government has the responsibility and can take that on for addressing dangerous work in this country. Now, I want to be clear, under the law, it is the employer's responsibility to provide a safe workplace, free from recognized hazards, and workers have the right to know that they are working with, what they are working with, and to be protected by their employer. But we use the government to hold employers accountable because they don't automatically play by the rules. And that's why your activism is so important. Any worker I talk with about asbestos says they have a specific protection at work thanks to the regs. So the RBAN bill that ADAO and the AFL-CIO and so many others are trying to get passed through Congress is so important. We are focused on prevention. We want to stop this ongoing lifetimes disaster. Why do we need yet another law on asbestos? We have so many. The myth is we banned asbestos decades ago. It's no longer used, and so it's not a problem. Early regulation of asbestos is out of date though, and it doesn't reflect the magnitude of the current and the future asbestos-related disease problem. The first asbestos standard was an emergency action in 1971, led to a final standard in 72, but that standard failed to adequately protect workers. So we continued our efforts to reduce asbestos exposures through the 1970s, the 1980s, the 90s, repeatedly seeking stricter control measures through petitions, legislation, and court action. These efforts, these laws are critically important. It's why we have some safeguards today with asbestos, but each of these addressed only one piece of the puzzle, a particular use or a particular product, because it's what we could get through at the time, and it's because it's what we knew about at the time. And we don't have that excuse now, though. It is abundantly clear now that we have to address the whole issue. We need to ban it, to track it, and to do a better job confronting the asbestos throughout our infrastructure that we were told was safe decades ago. This is what our ban would push the government to do. Important for workers, the RBAN bill would require the government to do an assessment of this so-called legacy asbestos. It would take important steps to begin addressing this issue. The government hasn't performed a comprehensive assessment of asbestos since the 1980s. Since then, we have made no attempt to understand where asbestos is today, the condition that it's in, and the jobs performed that create serious exposures to it. We need to confront this as a society. We cannot ignore this epidemic any longer. We have our own playbook. We need to eliminate it. We need to eliminate it in supply, prevent the exposure, and take care of those already exposed. The bill does the first two of these. The asbestos journey has taken petitions, legislation, court action to do what we have done so far, but we need to keep going. I'm calling on you to take action today. Since you're all at your computers, I'd like to introduce a new petition to make the RBAN legislation a priority for Congress. Alan Reinstein Ban Asbestos Now Act needs to be reintroduced, and it needs to be passed to save lives. Please go to actionnetwork.org/letters/RBAN, and please add your name and join us in the fight. Make no mistake, these are long, difficult battles, and our international partners know this all too well. Other industrialized countries have ignored legacy-associated exposures to asbestos, but some have decided to act. For instance, Australia at least has now developed a national strategic plan for asbestos management and awareness, which outlines a plan for assessing the current asbestos in place in Australia. But their battle and the battle we are trying to fight globally on asbestos is far from over. Other countries want to keep producing it because of an economy they are used to and that they profit from, without regard to making the economy healthier, which they can do. Delays in worker protection rules have cost so many people their lives over the years. In the US, we've tracked some of these life-saving protections we have worked to get past. I mentioned silica and beryllium early on in this presentation. This is what delays do to people's lives. Linda, ADAO, and all of you know that you've been working tirelessly on raising awareness and eliminating asbestos exposures from our communities. And sometimes the fight can feel hopeless or overwhelming, and that's normal. In my office, I have a framed quote propped on the desk of my desk. It's by the poet Jacob Riis. When nothing seems to help, I go and look at a stonecutter hammering away at his rock, perhaps 100 times, without as much as a crack showing in it. Yet at the 101st blow, it will split into two, and I know it was not that blow that did it, but all that had gone before. It is not one action or one meeting that will get us over this finish line. It's all the work that has gone before us and the persistence that ADAO is known for. It won't be enough to pass this law even. We will then need to ensure that the workers doing all these stages of assessment and future removal and disposal are safe on their jobs. But we won't stop fighting. Remember, there's no safe level of exposure to asbestos. So in closing, I just want to say that decades ago, asbestos was on the front burner, but people have now forgotten. And like my friend Scotty says, those of us who are sick because of asbestos, we don't forget. Thank you very much.
Thank you, Rebecca, for that great talk. It was jam-packed with information. What I would like to do is just repeat your call to action. So I'm just going to spell out that the link and encourage people to go right now. Let's take 1 minute for everyone. So the link is actionnetwork.org, actionnetwork.org/letters/RBAN. And go right now to your computer, click on that link, put in your name. It asks for a topic, and I switched mine to health because I think that's what this is all about. I love at conferences when there's like an activity to do. I think that just brings it all home about why we're here. Rebecca, you mentioned this phrase legacy, and I'm wondering if you could just talk a little bit more like about that term and what it means. I think it's kind of lost on people. And what are some of the different kind of jobs that would be affected by this phrase legacy asbestos?
That's a good question, Celeste. Legacy, we hear the term legacy asbestos, and what we try to remind people is that legacy asbestos is not legacy exposures, right? This is the asbestos that was put in buildings decades ago, and it's still there. But as I mentioned, as this stuff deteriorates over time and with different kind of, weathering conditions, it's all falling apart now. So what happens is now you're seeing the exposures from the stuff installed 40, 50 years ago. And that's what's making people sick. So when we see new people exposed, new people getting diseases now from asbestos, it's because of the stuff in old buildings, old homes, these old pipes. So it's really an issue that affects workers across the board. You can imagine, I mentioned a lot of industrial workers, right, who work around pipes or, ripping out, ceiling tiles, or doing, or even electricians who have to just get in and work with wiring, but they're near a lot of asbestos. But you can also think about people who work in schools. You have maintenance workers, you have janitors, you have teachers, you have people who are in these buildings every day. And there are some examples in like school gymnasiums where the stuff is just like falling from the ceiling because of all the vibration all the time, right? Playing basketball, other things. And so it's not in good shape. And it's past, it had its use back in the day. It was toxic. We didn't know it then, but it had its purpose. And now it's not even doing its job anymore, and it's falling apart. And what it's doing is making so many people sick. So it's really occupations across the board who can really be at risk for being exposed to asbestos.
And that really resonates with me because you mentioned that it's younger people being exposed. So probably some of those previous generations, the insulators, they knew about asbestos. But we have this kind of belief in our country that it's been banned, and therefore, like, people aren't exposed anymore. But like you use that great term, it's not legacy exposures. The exposures are happening now. Linda, did you want to add something?
Yeah, well, I just want to first throw a shout out to Rebecca. I didn't know you had a link up for RBAN. So maybe that's new. Maybe I missed it.
It's brand new.
Well, that I think we need to re-up that one, Celeste, at every presentation. As a professor, you do that. Rebecca, your presentation was excellent. If Scotty's story and all the others aren't told and shared, then we can't move it. Without AFL-CIO on board, it is very hard to start the train, and you guys have always been there. I don't know how many people today know that it was the unions back in 1920s that said, we're getting sick, and they started pressing John's Manville. I mean, unions are huge, and we thank you for your support. In fact, Pat Morrison was at our very first 2005. That being said, when your workers, not all workers obviously are members of AFL-CIO, and that's a tragedy. And when the workers go to work and they come home with soiled clothing, their families can get sick. So we really respect and shout out what you guys do, because we need you. I had goosebumps, Celeste, that there was a new link to take action. Thank you, Rebecca.
So I have a couple, maybe this is both for Linda and for Rebecca, but I'll start with Rebecca, and then Linda, you can chime in. So Rebecca, over your time working at the AFL-CIO, I know you interact with members of Congress and with their staff. And so when you raise the issue of asbestos, like for all of us, we get it, like, you know, but they obviously don't. So like, what are the things that you hear from them that you have to educate them about?
Well, I would say the first thing that we hear is asbestos isn't banned. I mean, we hear that from actual members of Congress, you know, many who may have been construction workers themselves or have worked in certain occupations over the years, or their family members do, and they are quite frankly shocked that it's not banned, because that's really what industry has led us to believe over the years, is that there's these asbestos bans, or the government has called them asbestos bans when they've really been so limited to a certain use. So so that's the first thing we hear, and it's you know, you don't want to make anyone feel dumb, but you kind of have to start saying, okay, let's start from square one. So step one here. And so we hear that. We also hear, I think, you know, a lot of the myths that I touched on in the presentation, which are things like, well, older people are getting sick now because of the asbestos long ago, right? They installed asbestos, they worked with it when it was, you know, active, new, and legal, and we've taken care of that problem. We don't use it anymore. We don't allow it in commerce, which is wrong, as you know, from this bill that we're trying to get passed. We don't have an issue, and I think it's because people just haven't really been made aware about how much of an issue it is that this older asbestos is falling apart and making people sick. And we track a lot of the data that comes out, any of the monitoring data that's out there, like the CDC and other data sources. And you can actually see in younger populations, the numbers are going up, right? So we are, I think, at, you know, about to face this brunt of really major number of cases among younger people. And what we're going to see is these numbers continue to rise, because the older that this asbestos gets, from the 20s, the 30s, the 40s, the 50s, the older that stuff gets, the more it's going to fall apart, and more people are working with it. So, so I think it's just a common misconception. And I think it's just because we've all heard that asbestos has been banned. And so it's no longer an issue, or that's just something you fight for a couple people who are still exposed, you know, that's just not the case at all.
Great, thanks. Linda, you want to add something?
You know, that was just a great question, because I think we have to think of staffers as these. I'm a mom, obviously. I think about all the many things I do as a mom. Staffers are multitasking. They are in charge of a portfolio. It's very hard to manage everything for their boss. And I think the biggest thing I get from the staffers is, this is so complicated. So we have spent 17 years trying to make it less complicated, but it is. So maybe we can work together on a staffer resource set, or another briefing. Celeste, we showed that. I think those are really helpful, and AFL-CIO and APHA have come to the forefront. Celeste, you mentioned a member, I believe, possibly Mr. McKinley. Tell us what you remember from that hearing.
So, you know, when you are testifying at a hearing, you know, you're sitting there, and it was actually the three of us plus maybe one or two other people, and you're looking at that dais, and on one side of the dais are the Democrats and the other side of the Republicans. So, you know, then they start asking questions, and you know, I'll admit I lean Democratic. So when the questions started coming from the Republican side, I was like, oh no, what are they going to ask? But this was Representative McKinley from West Virginia, and he's a Republican. And he started off his question by saying something like, you know, I had a construction business. I was involved in construction, and we don't use asbestos materials in construction anymore. We don't use asbestos, you know, insulation and different things. And he said that he was shocked to learn that asbestos hasn't been banned, that there were other industries that still rely on asbestos. And he seemed kind of, offended by that, in the sense that our industry, construction, has, been able to succeed and not use, fine substitutes. And like, why are these other laggards industries still using asbestos? So for me, that was very thoughtful, in the sense that when members of Congress, are educated about this, they see that it's just like, it's ridiculous and it's common sense not to be exposing members. And it also was a lesson to me to not prejudge just because of what side of the aisle the member, would be sitting on, that we shouldn't assume that they are, yay, we like asbestos. I think that hasn't been my personal experience meeting with, a limited number of members of Congress, but it just tells me there are allies out there and we just need to, pull them in.
One quick side note, Celeste and Rebecca, without a ban, and you're going to hear in session 3, Brent, I think, is going to be leading that. You're going to hear without a ban, and he does abatement and works for Environmental Information Association. There are still products coming into the United States, construction products, that are contaminated. We just don't have like the labels on the pipes saying non-asbestos. So there isn't a line of demarcation. So even though companies don't want to use it or try not to use it, we still get contaminated products. So I think Brent has an example that there was a house that did abatement, and then they brought in new materials and they were contaminated. So a ban is important, a legacy study, AFL-CIO, APHA, and chemical data reporting. Let us meet them where they are, and let the chemical companies tell us, are you using it? And tell us where, because we deserve the right to know. Rebecca, what do you want to say to the audience? Because you and Celeste you're like my idols, my powerhouse girls, and I have the greatest respect for both of you. Give me a parting message. People are going to hear so much information. What do you want them to know about the union? And I think we should throw that to APHA. And what can people do? 2 questions.
No pressure. It's a loaded question, but I think obviously in this conference, we know that asbestos is a carcinogen, right? This is something that everybody's been talking about this conference. We know there's no safe level to it. We also know that we can prevent it. I think so many people think, well, asbestos is out there. People are going to be exposed because of their jobs. This is just what happens. We hear this all the time with workplace exposures. It's just part of the job. And it's actually not under the laws of this country that you deserve to be sick on the job. It's actually the opposite. So I think, understanding that we can prevent this, we know how to do it. It's not a mystery. And to know that the policy fights can be long, they can be difficult, but they have massive impact when you get your win. And so I just think that it's important to know that, to keep fighting, and we'll keep fighting from the unions.
Celeste, what do you want to share about APHA and your amazing work? For people are going to be angry when they hear this. I think people are going to wonder, why were we bamboozled? What do you want people to know?
Well, just the American Public Health Association is the largest public health association in the U.S., and public health is all about people and prevention, and APHA stands strong with the AFL-CIO and ADAO and in fighting for once and for all a ban on asbestos, and not a fake ban like Becky was suggesting has happened over the years, where not everything is actually banned. So that's where APHA stands.
So if you guys didn't get the directive from Celeste, please take action now and sign this letter. And maybe, Becky, we should put the AFL-CIO logo on this when you have a time, because I want you guys to have credit for this. This comes from your work. Heartfelt thank yous on my side. Celeste, I turn it over to you.
Thank you, Becky. So, I call her Rebecca, but I've always known her as Becky. But thank you so much. It really is sincerely. I'm so proud to know you and all that you've accomplished in your. I still think of you as a student in your short career. Thank you so much for all your inspiration and all of your excellent work.
Thank you, Celeste, and thank you, Linda, the dream team right here.